All right, so let's talk about capsular contracture. So, capsular contracture is a problem when the scar tissue sac around your implant becomes thick and abnormal. So, anytime you implant a foreign body in your body, whether it's a breast implant or a pacemaker or anything else for that matter, your body recognizes it as foreign and will wall it off with this scar tissue sac, and that's what we call the capsule. So in general, with breast implants, most contractures happen for two reasons. A ruptured silicone implant, the internal silicone is irritating to the capsule and causes inflammation, or biofilm. So some bacteria and a biofilm in some patients can cause inflammation, which leads to a thickened capsule. Now, biofilm doesn't always cause a contracture, but certain people seem to have more trouble with this than others. The other population of patients I sometimes see are women who have bleeding complications around their implant, especially when they don't have that bloody collection drained in an operating room, when it's just left to go away on its own. That population has a higher risk of contracture as well, and we think it's because of the inflammation of your body trying to get rid of this bloody collection around your implant. So over the years, we've gotten better as plastic surgeons at preventing contractures. So now we use sterile funnels to place implants, special irrigants. We don't use incisions that have higher rates of contracture. You make your incision large enough so you don't hurt your implant or break it on the way in. We do all kinds of things that have really minimized the risk to you as a patient. So older studies like the implant approval study show a rate of like 10 to 15%. Now the more recent studies, less than 2%. So we're doing a much better job of preventing it. And then we've also learned a lot about how to treat it. So although there's some controversy with exactly what type of capsulectomy or how to do the surgery, in general, you want to remove the entire scar tissue sac, make sure you are checking and treating a patient for biofilm, and then go to reconstruct the patient in a way that will minimize the chance of the contracture coming back. And usually we utilize some kind of support product, whether it's a dermal matrix or a mesh. So our treatment continues to evolve with time. So we use dermal matrix first, both human and porcine versions of it. There's been a variety of clinical trials you can look at on PubMed with results from using this for capsular contracture and different types of breast surgery. And then in recent years, we've moved to more meshes. And one of the big drivers for moving to mesh for treatment of capsular contracture is that portion of the surgery is typically not covered by insurance for cosmetic patients. So cost is a huge factor, and mesh is much less expensive. So as with everything in plastic surgery, our treatments are always evolving, and there's always studies going on looking at different methods of managing contracture and other problems. And hopefully in the years to come, we'll figure out which one of the various meshes is superior, which type of capsulectomy is superior, and we'll continue working towards the goal of getting the best possible treatment for our patients.